So the Cal Expo just opened recently, and it's open only to those in phase 1A, so it's healthcare workers.
And I guess my follow-up to that would be, is it only healthcare workers who work in Sacramento County? Like, it's pretty limited there even, isn't it?
It is only healthcare workers who work in Sacramento County. In some situations, we have also vaccinated those who work elsewhere but live in Sacramento. So either work or live in Sacramento County.
Okay. Let me ask that again, maybe in just a little bit of a different way. So, because people are asking, can I go there? Can I go there? Can I go there? Who currently has access to Cal Expo?
The Cal Expo site is by appointment only. We have to send you a link so that you can register. And right now it is only for healthcare workers in phase 1A. Anyone who in that phase 1A who either lives or works in Sacramento County.
What is the plan for Cal Expo in the future?
Well, in the future, once we have gotten through phase 1A, we are planning to move on to phase 1B and down the road be able to open it up to the public. But right now, we're really focusing on some of those priority groups in 1A and 1B.
Do we have any guess as to when we expect things to ramp up there?
We are planning to ramp up in the future, but it's very dependent on us being able to get more vaccine. Right now, we have a very limited supply, and that has impacted our ability to ramp up.
I do want to say it like this. What do you think of the fact that Cal Expo is being touted by the governor as this, great thing? Do you think that that's misleading people?
Well, I think it's too soon to it's too soon to let people know about the site because it's not available to the general public. Definitely once we get to that point and we have gotten through some of our priority groups and we're able to open it up to the public, we will provide that information and we will make sure that everyone has access. But right now it is not accessible to the general public.
Let me ask you this too, because I've been getting this. So who is able to send people to Cal Expo right now?
We have contacts of the groups that are in phase 1A of the healthcare workers. And those are the ones that we are sending information to so that they can get access. And this includes healthcare workers, physicians, and their office staff that work in private clinics, specialty providers, social workers, and also EMS workers as well.
So is it fair to say that it's either the health department or health providers that are able to arrange those appointments, essentially?
That's correct. It's only the health department that can arrange those appointments.
We're also getting a lot of calls and a lot of messages from people asking if people from other counties can go to Cal Expo. What would you say currently?
The people from other counties need to check with their county. If they do work in Sacramento County and they are in phase 1A, then yes, they will get access to Cal Expo. But at this time, others outside of phase 1A and those who do not work or live in Sacramento will not be able to get access.
Do we expect in the future that Cal Expo will be opened to a broader audience, including people from other counties?
Each county is allocated vaccine based on population. So I think that it will be easier for people to go to their own county to get vaccinated.
So let me ask you this. Do you think it's misleading then to call these mass vaccination sites if it's only particular to that county?
Well, the plan is to make it a mass vaccination site once we open it up and once we expand the capacity. But right now we're just ramping up. We just started opening up to appointments.
Okay, let's talk about this 65 and older, because this is also our other area of just question. So are you concerned that the announcement that anyone over 65 can get the vaccine, are you concerned about that when we are not even through 1A right now?
It does cause some concern because a lot of people, when they heard the announcement, they tried to contact us, trying to find out how they can get the vaccine. And we're trying to tell everybody, please be patient. We will get there, but right now we really need to get through phase 1A, and we also need to get additional vaccine so that we have more capacity to be able to reach everybody in that age group.
So we did hear, like from UC Davis, for instance, who is starting to vaccinate patients, but that would imply that that is group 1B. So how would you say that 1A and 1B is happening simultaneously?
I think the most important thing is being able to get enough vaccine so that we can continue to vaccinate the priority groups in 1A and 1B and complete that. But some of the hospitals could also be able to start vaccinating, for example, those 75 and older, and then move to those 65 and older. But it's very contingent on us getting enough vaccine.
Would you say something to people along the lines of kind of what you just said? There's going to be the priority groups that come before those who are 65. So if you're 65, you're still going to have to wait for those priority groups to get through?
What we would like to do is to be able to have enough vaccine so that we can continue with the priority groups and then be able to start doing outreach to those over 75 and then those over 65. So kind of phase it in and not wait until we finish one group to start the other, but do a bulk of it before we're able to move on to the next one.
So for people who are 65, if you would give them your best estimate of a timeline, what would you say?
Our goal is to be able to finish phase 1A by the end of January and then be able to move into the other phases. And again, if we're able to get additional vaccine, then we can move faster and it will help us to move faster to get to the age group 65 and older.
So you would at least predict somewhere in February. Does that sound accurate?
February or March, yes. It's all dependent on the vaccine.
So for people who are 65 and older who are clamoring for a vaccine right now, what would you say to them?
We ask them to be patient because this announcement was made just yesterday. And so we're having to look at our strategy, our plan, and see how to accommodate it. And also, again, we're waiting to get additional vaccine. Once we know that we have enough supply, we will put out the word so that people will know where to go to get their vaccinations.
And would you give me a sense of how much vaccine we have right now and what that would actually cover?
We actually have used up almost all the vaccine, at least in public health, that we had on hand because we were working with the challenge of being able to get to 1 million by the end of this week. So we are waiting to be able to get additional vaccine so that we can continue with appointments for next week.
And as you said, we're not even through 1A, so.
Right. Okay. Sacramento County is large, and I think people need to remember also that it's not only our residents. We have a lot of additional people who may live in other counties but work in Sacramento County that we have to account for with our vaccinations. So it is taking us a little longer to get through phase 1A than some of our smaller neighboring counties. But we are working hard to try and make sure that we move that vaccine as quickly as possible. And once we get more vaccine, because we do have several partners who are willing to come on board and help us with the vaccination. So once we are able to do that, then we'll be able to get to the different groups sooner.
Okay, and the other thing that we're hearing from a lot of people is they have been reaching out to their pharmacy or their healthcare provider, and those entities don't have any information or are not getting back to them. What would you say to them?
That they should wait until we provide additional information. The reason that they're not getting back to them is because they're waiting also to get additional vaccine.
Okay, but in terms of information, are they also waiting for information? Those pharmacies, CVS, Kaiser, we've heard a bunch of different people or groups.
Yes, but still we, in the county, we still all tend to go at the same pace. So they are still waiting for us to be able to get to the point where they can start allowing other groups to get appointments. Because with the pharmacies that we're working with right now, they're still dependent on us to send them groups in order to make those appointments.
I think I already know the answer to this, but because people are so eager after hearing this information from the governor, do you think the announcements that people over 65 and mass vaccination sites are available is a little premature?
Um, I can understand where that is coming from because those over 65 are at the greatest risk in terms of severe disease and death. So I understand that, but I think it's also important that the state provide us with the vaccine so that we can follow the guidance that the governor wants us to follow.
I'm sorry for barraging you with questions. There's just so many out there right now. I know you know this. Is there anything else you want to say that I haven't asked you about?
I think just to remind everyone that we're still in the surge and that even as we start the vaccination, we still need to remain vigilant, still need to continue with the preventive measures that we've had in place, social distancing and using face covering and avoiding gatherings.
We are now back in the purple. Does that cause you concern?
Um, Definitely for the businesses, it was good news. We're still cautious because we are still in the surge, although we are seeing a plateauing in the number of additional cases we're getting. So it might be an early indication that we're getting past this surge and that we will turn the corner. That, of course, is our hope, but we continue to monitor and see what will happen within the next week.
And would you say anything to people? I think you did, but even though we're purple, don't let your guard down kind of a thing?
Right. Even though we are in the purple tier right now, please don't let your guard down. We still need to remain vigilant. Use your face covering, 6 feet separation, and please don't gather.